That's agelesshealthbook.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, and we have a great program lined up for you. Matter of fact, one that I've kind of been poking to get on the air now for probably months, but he finally acquiesced. He said, yes, I will. And we're going to kind of continue the conversation on concussion. Who am I talking to? I'm talking about an expert in the area of concussion. Matter of fact, he has a whole program called Concussionology. I think I got that right. Dr. Evan Mladenoff, a very dear friend, someone who I've known for decades. He's the doc for the Kansas City Chiefs for about 12 years, chiropractor, applied kinesiology is extraordinary. And I mean, the list goes on. He's an amazing physician, doctor. And I have the privilege to call him my dearest friend in the profession. He has it where most people are just beginning to step into the water. This guy is an expert. And when I say expert, he teaches this to every physician, every doc that you can possibly think of. Having said that, I want to start out by telling you, he just came out with a brand new book, very simply, and the letters may be reversed on this, and it says, Doc, when can my kid play? And you're going to be able to find this on every social media platform. I'm going to ask him, where you can pick it up, but you'll have it on drtomroselle.com. You're going to have it on rosellcare.com. So you'll be able to pick it up. And we're going to get some, they'll be here in the office as well for those of you who are patients that can come in and out with, hopefully within the next couple of weeks, and you'll be able to buy them here as well. But let me tell you something. When this man goes to detail, but more importantly, taking detail to go to application, it's beyond usable. So do yourself a favor and pick a copy of the book up. But in addition to that, join us this Wednesday evening at the Roselle Center for Healing in Fairfax. And we're going to be doing a night on concussion patterns and brain trauma and things that have happened. And we're going to cover everything from how it affects hormonal function and not only cognition and mentation and pain patterns and things that just don't go away, but we're going to also lay the standard of how this stuff can be reversible. And that's where we're going to put the question out to Dr. Mladenoff today. Anyway, having said that, Dr. Evan, welcome to the program.
Thank you. It's awesome being here. And I have not skirted the issue to come on the show, but we've spent the past year just trying to get this book out, and we finally did it October 1st. So when you do get a copy of the book, in the back section on the resources, make sure you go to those resources, because we've got a bunch of free stuff for everybody that will help them get better faster. So one of the things in the book that you will intuitively notice is like, okay, he doesn't tell me how to fix it. And the problem is the book would have been 5 times as long and would have taken probably 10 years to finish to write. So that's why I decided when someone gets a concussion, especially an athlete, the first words that come out of their mouth is, "Doc, when can I play?" That's why I called the book, "Doc, when can my kid play?" Because parents bring in their kids who have had trauma. Let me give you an example. We had a young man come in. He was a senior in high school, in a private high school, and a fairly good wrestler. And he had had a concussion at the start of the wrestling season. State championships were coming up in a couple of weeks, and he wanted to wrestle. And his parents were concerned that he was not doing good. School was not a problem because he was an exceptional student and probably could ace exams without even studying. That's how good this young man was. But he was still having a lot of symptoms, a lot of headaches. So it takes us 4 hours to do our examination for a concussion if we do everything all in one shot. But I want to describe one thing that we kind of left off from the radio show, and that is doctors need to understand and patients need to understand 3 letters called EMC, and that stands for exceeding metabolic capacity. And simply what that means is our brain can only tolerate so much stuff, so much incoming information, so much outgoing information. And when it passes the magic line of too much, the patient, your brain literally goes zombie. I call it going zombie. The patient is not unconscious. They are catatonic. They are non-responsive. They are not in a life-threatening situation. But if you say to that person, "If you can hear me, blink your eyes," they can't even blink their eyes. They hear you. They know what you asked them, but they're just almost comatose without being comatose.
Evan, is there a pupillary reflex with that? I'm sorry.
Okay, so that is the whole point, is like, okay, how do you know when you're near that point? Before we start our exam, we do 2 things. We check, does their pupil constrict? Okay, and we also can take their pulse too. As the patient fatigues in our exam, their pulse will start to slowly increase. So I'm just picking a number. If their pulse rate starts at 60, and as we go through our exam, it starts creeping up 65, 66, and it goes to 70, we say, okay, time out, we're stopping the exam. Or if the pupil, if it doesn't constrict when we shine a light in it and it starts to dilate, the brain is fatiguing, we say, okay, we're stopping the exam. 9 times out of 10, the patient, family members say, "Oh no, he's doing good, let's keep going." I said, "No, I promise you, you will be very upset at me if you continue. So we're going to stop the exam." And now we typically will wait 36 to 48 hours before we continue whatever exam pieces need to be completed before we do that to the patient. 99 times out of 100, they come back and say, "How did you know what was going to happen to me? I got home, I fell asleep, I slept for 18 hours, I had a headache for a while, it's easier now." And I said, we do stuff differently, starting with, you can do too much examination stuff. Equally, you can do too much treatment stuff. It took Dr. Chip, my son, it took him a week to examine me for that 4 hours after my bicycle head trauma. To do one treatment in our clinic not counting the hyperbaric oxygen, it takes an hour for all the pieces that we typically would do treating a concussion. It took him a week to treat 1 hour's worth of therapy. It took him 2 weeks to, number one, examine me, and then number one, give me my first treatment. That's how bad my head trauma was. So what does this have to do with your listeners? Okay, you need to take your pulse every morning. If your pulse is, let's say your pulse is averaging 60, you wake up one morning and your pulse is 68 instead of 60, guess what? You're going to have a bad day if you keep pushing hard like you do every day. You need to back off. You maybe need to take a little rest at lunchtime, right? And one of our friends developed that for athletes decades ago, Dr. Phil Maffetone, about the aerobic deficiency syndrome. This is equally applicable when you deal with concussions. We do not want to drive the brain so hard just because we want to find out what's wrong, just because we want to get the patient better faster. So as physicians, we have to be cognizant of that exceeding metabolic capacity, that magic line of too much. Having said that,
Evan, let me take another step. You talked about heart rate variability. You bring it up in your book, and you and I have discussed it exponentially. Heart rate variability means what, particularly when it comes to injury to the nervous system, but brain traumas, we're talking about it. How is that correlated? What does that mean? A lot of people say, oh yeah, I'm checking my heart rate variability. My doctor told me, but they have no damn idea what it really means. And in understandable terms, what's the application? What is it? What's the application? Why is it important?
Our nervous system has what I call a silent operating system, just like your computer has a CPU, right? A central processor. Stuff happens in that box that I have no clue of. I just want to know, can I push a button? Can I talk to Dr. Roselle and see him? I don't need to know all the underpinnings of how that works. That's the silent operating system. Our body is the same way. That silent operating system has two parts, and people may have heard this. There's the sympathetic part and the parasympathetic part. And heart rate variability measures that silent operating system. And it does it by measuring the space in between heartbeats. It's not an EKG, although it'll tell you, okay, this person probably needs to see their cardiologist because there's something funny going on with the pulse. But the bottom line is it's measuring the space. The healthier you are, the more your heart varies. When someone says, oh, my resting heart rate is 60 beats per minute. Well, not exactly. It averages 60 beats per minute. So the healthier your heart is, it should be, if you took it every second, it'd be like 59, 61, 58, 60, 62, like it'd jump all over the place, but it would average 60 beats per the minute. That's why when someone gets a pacemaker in, they pace the heart so that it is exactly 60 beats per minute or whatever it is determined for that patient, and it doesn't vary. And that's why they get fatigued quickly. Their heart cannot adapt to any change that they need to drive more blood to their body, right? That's what a pacemaker does. So heart rate variability measures that silent operating system, and then the technology will then allow you to determine other things. We've had about 7 different heart rate variability examining instruments. So when you have them on your wearable, it just gives you a number. Your heart rate variability is 10 or 50, whatever scale they're using. Well, they just give you a number. That's like you're going 70 miles an hour in your car. It doesn't tell you what the temperature is outside. It doesn't tell you road conditions. It doesn't tell you all those other things that can determine how fast you could go or should go, right? The heart rate variability instrument we use, which is one of the leading technologies on the planet, it tells us about inflammation. It tells us about your neurotransmitters in your brain. It tells us some cardiac function. It tells us about your sodium and potassium levels. When we talked about on the radio show, there are metabolic changes that happen, and then there is neuroinflammation that happens. Those are 2 different chemical reactions. We get information on all that stuff within 5 minutes when we do that heart rate variability test. It's totally passive. We put 2 sensors on the patient's wrist. They're like clothes pegs, if you know what a clothes peg is, right? So just a little pressure on the wrist. The patient just has to sit there. The hardest part of the test is no talking, and then they have to keep their eyes open. Now, one of the things that the clinic has to be cognizant of, the room where our exam room, we have a video board where it's an education system. You need to make sure that's turned off, because if they're watching video, their eyes will be twitching, watching the stuff on the video board, and that will change their heart rate variability. So it's got to be a quiet room, no visual stimulation to them. They keep their eyes open, and then no talking. Their feet should be on the ground, because if their legs are swinging, that will change the heart rate variability. But it's a pretty amazing tool. In 5 minutes, we get answers. So on some patients, we will even do pre and post testing. One patient we found wasn't getting better to our satisfaction. And going back to that order matters, what we did was we did a heart rate variability on this patient. We stuck him in the hyperbaric chamber. Then we redid for an hour. Then we redid the heart rate variability. On another day, we did the heart rate variability. We did some acupuncture, cold laser, and adjusted them. Then we redid the heart rate variability. And what we found was the patient did better when we did hyperbaric oxygen first, and then all those other treatments second. That's how quickly we got answers with this instrument that gives us this data, which is fabulous, because it allows us to pinpoint where the problems are and then determine the order and sequence of things that should be treated.
I mentioned on the radio program that anytime that there's trauma, if you don't get to it very quickly, and you follow up and said that the sooner is better to treat somebody, diagnose them, and get moving after an injury, a concussive pattern. And if you wait too long, and we're talking about days, and any more than 72 hours, you already have the infiltration of scarring into the different portions of the brain and the cord and so forth that have been affected if it's an induced injury pattern. So knowing that takes place, and that this is going to be set up, I asked you before, when this starts, can you reverse that input of scarring? Can you stop the inflammatory cascade? Can you restore normal neurological transmission? Because we're dealing here with several things. We're dealing with different tracks within the cord, from the brain to the cord to the body. We're dealing with neurotransmitters. We're dealing with an inflammatory reaction that we have to get under control. How do you deal with that? So in the situation, obviously you've been involved with sports and high-level Olympic athletes and NFL. You were the doc for the Chiefs for years. You still see them. Your office is loaded with them. As I treated, they'll kill me in Washington by saying the old Redskins, but I treated many of those over the years. How do you deal with these guys and say, yep, go back and play. You're going to be okay. Don't worry about it. You're in a good place.
Okay. The easy answer, if you just go onto the NFL website and look at whatever concussion information they got there, they will tell you that there's five stages for return to play, but they don't list what tests should be done. But basically, wherever you go, when you are symptom-free for one stage, which can be one day, then you go to stage 2. So according to the NFL, you could be free of problems. You can play in as little as 6 days. But the problem is they're only basing it on symptoms. So if you have no symptoms, therefore you're okay. Well, you're not okay, because there are 5 areas of injury that can happen. So now we have another problem. Some symptoms of a concussion may not show up for 72 hours. You might not have instant symptoms. The other problem is when you start looking at the literature, some blood tests will show, if you've ever heard of Alzheimer's disease, one of the hallmarks of Alzheimer's disease is this substance called amyloid beta plaque. And it's a chemical in the bloodstream. Well, it can show up within 4 hours of a concussion. You're already starting that chemical cascade to lead you down the path where Brett Favre is right now. He didn't have that addressed initially, or probably ever, and now the nerves are rotting in his head, basically. There's no polite way to say that, but that's what's going on. 2 questions. Can that be reversed in a patient like Brett Favre right now? And the high probability answer is no. Can treatment be done to modulate, dampen down the symptom demise that he's having? That is a high probability. But reversing this like it never happened in him is probably not capable.
Evan, we know, and you and I have read a lot of the same literature, that the brain is holographic. So every part of the brain has the memory and the capacity of every other part of the brain. We know that the intestinal tract is known as the second brain. Why? Because it produces the neurotransmitters that the brain needs and the rest of the body needs. But the majority, 80% of them, depend on your authors, produced in the gut. So if you dampen the inflammatory reaction, which triggers, by the way, that amyloid and tau proteins within the brain, is there potential? Now, when we see somebody like that, I don't do all your protocols, but we're using laser patterns and acupuncture, and even now we're using something called a Rife frequency unit, a pulse unit, to kind of reconnect the normalization of different parts of the body and so forth. And so, is there a potential, knowing, going back to what you said, that the brain has the memory of every other parts of the brain, that even though you can't repair one area of damage, that you can reinstitute the normal pathways, if you will, in a different portion of the brain, and it takes over? It's like, if you have the center of your brain, the chiasma communicating to one side, you can get the brain to make up for that. Potentially, is that possible, in your opinion, or not?
Yes. Yes, and yes, and yes. And emphatically yes. And I'm going to give you a word that I know and most of your listeners have probably heard this word. It's called neuroplasticity. And all that means is that nerves that fire together will wire together. This is how an athlete learns a new skill. I remember, I'm going to date myself now because I'm obviously only 28. A fabulous basketball player named Julius Erving. They called him Dr. J for short. And he would do these amazing moves on the basketball court that now are commonplace. But they weren't back then. And I remember seeing an interview and they said, how in earth did you do this move to contort your body? He says, oh, it's simple. I did it at least 10,000 times in the basketball court at midnight by myself before I even tried it in a game. So he had wired his body, all the little pieces that he would do in these maneuvers over repetition were wired so that it was instantaneous memory. Just like, you do a deep tendon reflex, when you hit the patient's arm and their arm jerks, that's exactly what can happen. Using those principles, you can rewire the brain to do things even if part of it has degenerated or part of it is sluggish because of neuroinflammation or not enough neurotransmitter hormones or whatever the cause may be. So absolutely, yes, it can be rewired with specificity, with timing, with repetition, and it should be a certain volume. Remember that exceeding metabolic capacity thing? This is the time you want to exceed metabolic capacity, is when you're trying to rewire nerves, because the nerve on this side of the brain is not working so good, but we can overcompensate and make that side of the brain do what it normally should do that it cannot do now by doing these neuroplasticity or specific exercise routines.
Let's go to kids. You had a son that played high-level hockey for a lot of years. He was looked at the professionals, and Chip is an amazing doctor today, and works hand in hand with you, and I'm jealous as hell because of that. But as a matter of fact, you got two doctors in your family, and mine decided to go do other things. But I had a son who played D1 ball at Maryland until he got hurt. So with these guys at the level that they were playing, now my son obviously is older. Russ is in his 40s. Chip's in his 30s, correct? And,
almost 40, yeah.
Yep. And so because of what's taken place, do they stand the chance of showing things neurologically that you or I wouldn't have picked up over a period of time as they get older?
That's a curious question. So here's how I'm going to answer that. The first thing is, he had 3 concussive events playing Division I men's hockey that he didn't tell anybody, including his old man. It's like when we finally found out his senior year, we literally had a hyperbaric oxygen chamber in his apartment at school that he went into every day. So we started reversing things. But then we said he said he wanted to go to chiropractic college after he wasn't drafted. He had a tryout with a professional NHL team, and there was some politics in that because of there was a strike by the players. So the draft, anyway, that's a whole nother show. But my wife and I said, this kid's never going to make it through chiropractic college with all the intellectual stuff. He had 3 concussive events. It's like, okay, well, he made it, and he made it really well. He was voted intern of the year in his graduating class and some other award that he won. So when I look at him now, I can tell when he's off only because I'm his father. I'm with him every day working, and now technology has changed. It's an exciting, everybody says, Doc, when you retire? And I say, apparently not today, but there is so much wonderful non-invasive technology that is coming to the forefront that, especially with neurological conditions and concussions, are going to be magical. We get new technology. He's the first one I test. And you know what? He is, I would bet, Dr. Tom, if you examined him, you probably couldn't tell he had a concussion. So yes, it's entirely, totally reversible. So now at that point, I want to share something with you. I have a friend, and you know of this doctor. And let me ask you a question. As we're sitting here, there's a satellite up 100 miles in space that they could listen to our conversation if they wanted to, and they could even probably have a camera that would go through metal in whatever building we're in, right?
They can.
They can. Well, somebody, and it's probably going to be Elon Musk, is going to take that satellite, make it into a box about 12 by 12 by 12, and it'll sit about 3 foot away from you. And this is what I envision, they will be able to examine one single neuron and watch it fire. It's like, you want to be around when that happens? And the answer is, heck yeah, I want to be able to see that, because then unbelievable information would be able to tell about how to fix people with concussions, and more importantly, which is probably what I'm known for better than concussions, and that is like, okay, Doc, I got no symptoms. How do you make me better? Right? So that would be cool to do that kind of stuff. So technology plays a part in evaluating what should be done, and it's uncommon technology because of the pharmaceutical-based, insurance-based healthcare system. Should you get an MRI done? And the answer is, well, if you're a professional athlete, you get the MRI done an hour after you have the injury. If you're not a professional athlete, well, you take these drugs for 10 days, and if that doesn't work, come back. Then you come back, then they say, okay, that didn't work, so we're going to give you an injection, come back in 2 weeks. That didn't work, come back, okay, you have to go to PT for 6 weeks. And then if that doesn't work, 3 months later, then you can have the MRI. Well, why do they have to go through all that ceremonial technique, and a professional player doesn't, when they have more at stake for their body to perform? Like
standard of care.
Well, okay, I don't care what they call it. It's like, I don't want to use profane words on your show, Doc, but it's like, patients need to understand, okay, why do they have to go through those hoops and bells and all that nonsense when it's probably not going to work anyway?
I totally agree. And that's the frustration.
Can I answer your question? It's like I kind of went all over the place.
I know. Well, that's keeping you intact with that brain of yours. And I'm always in awe of, where it comes from when I ask you the right questions. It's like, it's this pocket full of stuff. Years ago when you and I went to school, and I'm a couple of years older than you are.
You're 30, right? I'm only 28, so you must be 30.
Perfect. Thank you. So, but what we were told, 2 things. One, that the brain did not have a lymphatic system that would clear debris and damage and so forth out of the system like the rest of the body. We call it Chapman's reflexes. And the other thing we were told, that once you damage an area of your brain, once you destroyed a cell, that it was never able to regenerate. You never replaced it. You began to shrink the numbers of cells. Today we know, 1, there is a lymphatic system, that a lymph system that clears the brain. 2, that the brain does regenerate. So this is a theoretical question. This is not necessarily, they're playing with it. As a matter of fact, a lot of this comes out of Elon Musk's work as well, that I was reading a couple of articles the other day that caught my attention. But if you can regenerate, and we know that the brain is not only plastic, where what's there will take over for every other thing. In your clinical observation, obviously we're not looking at this is standard, this is what's in the books and so forth, but does it ever strike you that that system got better, so it had to regenerate and not just a plastic override.
Oh, absolutely. Absolutely. Here's the problem with that. How do you observe that and how do you measure that? The standard of care in Western medicine, there's no optics of how to do that. You have to go outside the standard of care. Well, what is that? Heart rate variability is one of those things. A QEEG, a quantitative electroencephalogram examination of the electrical brainwaves. We put a swimming cap on the patient. It's got 19 sensors all over the head, and you have 5 brainwaves, like 5 radio stations that are broadcasting, and we measure what are they doing with your eyes open? What are they doing with your eyes closed? What do they do when we stimulate your fingers, right? So this technology is out there, but it's not mainstream, but it's rampant in the literature. You start doing literature searches out there, but it's not the standard of care. Therefore, people don't know about it. Yeah. But it is fabulous. Again, I want to backtrack a little bit because you tickled something in my brain. We have 2 kinds of patients with concussions. And you find the patient how you find the patient. You touched upon the gut brain. So your gut is your second brain, if you will. Some people say it's your first brain. So the gut brain connection, right? The person has a concussion and they have to deal with, what if the patient is a celiac disease patient and then they hit their head? That's a whole different patient complex because they have rampant neuroinflammation in their body because of the celiac disease. And here's the dirty secret about genetics. When a gene is turned on, it never turns off. The only thing that changes is how much is expressed or how much volume of symptoms happen because of that genetic switch being turned on. Well, you find the patient how they get the concussion. If they have any other condition that is inflammatory, that can be from allergies. Okay, let's play this weekend. They have all kinds of soccer tournaments in our area, and I'm sure your area too. So you get a young lady, they're playing soccer, a 12 to 14-year-old, she goes up for a header, 5 times hits her head, she's a little woozy, they say you're okay. Well, she has allergies and now the fall's coming out, so now her allergies are running out of control. What's that done to the inflammation in her body? So it just everything ramps up. So we don't even talk about that in the book, because that's a whole nother. So I got my second book ready. It's going to be the pre-concussion syndrome. And that is, okay, what's the state of your body before you even get that smack determines how quickly you will get better or not get better.
That's what we tell our patients when they come in with any condition, is that it's not what you're in complaining about. It's not the symptom process. What was the stage, the platform that occurred on? Yeah. And that's, for me, the most critical. When you have a concussive patient, and we did this during COVID because we're seeing a lot of neurological presentations that we hadn't seen before. So I was ordering inflammatory blood tests, interleukin pathways, and everybody knew interleukin 6 was cascading in the middle of COVID. But we ran a bunch of different ones to see, how bad the damage was. So we had not only something that was not only diagnostic that there was something going on, but prognostic. And we were testing the way that you and I test. We had all the COVID viral patterns and the vaccines and so forth. And we could tell if they were in the brainstem, which was an interesting place for them to hide. But we found that as the patient got better using the things that we use for even long COVID presentations, we saw the interleukin inflammatory markers drop. My question is, have you ever done that with any of your concussive patients before and after relative to measuring the inflammatory responses?
Have we done like before and after blood tests and that type of thing? Yeah. You know what? The easy answer is no, because of some of the technology we have. We get instantaneous answers instead of waiting 3 to 7 days for blood test results. Got it. So we have a little bit different way of accessing that information. But yes, we have pre and post info that we document, but typically not blood tests.
Cool. Evan, I could sit here and talk to you for the next 3 hours, because every time I sit in your presence, I shut my mouth and I listen to you, because you're amazing. Not just a friend and a brother who I love, but your breadth and knowledge of this subject is just incredible. I want to remind our listeners that your new book, Doc, When Can My Kid Play, is available. And it's coming out. You'll have it on Amazon. And when it'll be available?
Hopefully Monday. So I will give your staff a link to Amazon, and if it's not up, you can pre-order it on Amazon. So I will make sure that they get a link for that. And then when you do get a book, in the back, make sure you check out some of the URLs that we have for additional information, because we've got a wealth of information on concussion for anybody that wants to buy the book. So, the reason why I called it When Can My Kid Play is like, that's the first thing everybody wants to know. So let me say to this, I don't know how much time we have. I can go 3 hours because the Chiefs are playing tomorrow night. So we're good.
Oh,
so
okay.
I have the 3 hours. And that is, they want to know when they can play, but here's something that they need to do. And that is, it's called convergence insufficiency. So what you have to do is have somebody do this for you. You can do it to yourself, but you can cheat. You're going to have them take your finger. I'm going to do it from the side here so they can see what I'm doing here. All right. So you're going to have someone bring their finger close to your nose, right? And you're going to try and focus on it. And you got to be within 6 inches, right? So do your eyes come together? There we go. Do your eyes come together like this? They should. Now, this should be the first test that they do. Now, in the NFL and in college football, they have that tent that they put patients under, the player under. I don't know what the hell those things do. They don't even block out the noise. They just block out the cameras from seeing what they're doing on the person. They could be in there having a drink or something. We don't know. But the first test they should do, according to the literature and what we've experienced too, is, okay, do their eyes do this? Now, obviously, you got to know what their eyes were like before, because some patients can't converge before they had it. So you need to know that too. And they will know if they have this convergence insufficiency. Well, here's what happens is, oftentimes they'll one eye will do this and the other eye will look straight ahead. And it's like they can't even focus like that. Okay. Or they will come in and then one eye will immediately drift out. They cannot do this or stay there. There we go. That's a better look at it. The convergence insufficiency. If you have that and you had a concussion a year ago, you still have problems. Even if you have no symptoms, you have no balance problems, no headaches, no neck pain, no nothing, you still have neurological problems if your eyes cannot do that and stay like that for at least 20 seconds. So you can do, everybody can do that as soon as the show is over, but have somebody else do it for you. Don't try and do it yourself.
You're going to cheat anyway.
You're going to cheat anyway, right?
You're going to say, that's close enough, I'm good to go.
Yeah, exactly. And to that point, I referenced this in the book. There was a great book written by a medical doctor who was with the Oakland Raiders. And the book is called You're Okay, It's Just a Bruise. And it's in the old NFL era where basically they said, okay, I'm going to just tape you up and you go back in. And the guy had a fractured ankle. Or they would do something. In fact, they wanted to hire a friend of yours and mine. And this is a chiropractor, they wanted him to do IVs at halftime with the drugs in there for pain. He says, I don't do IVs. And you putting drugs in IVs to kill pain at halftime is like, okay, I don't even want to be around this. I don't want to be part of your team. But it's like the old days that you see what happened in medical care in the NFL. Well, that attitude is still around, even in high schools. Oh, kid, you're okay. You're bruised. You get in there. It's like, what have you done for me lately? And that is like, it's creating a lot of problems for a lot of young kids.
Yeah, if these kids, these young athletes, whether they're, grade schoolers playing soccer or, flag football, they're still bumping into each other, still hitting each other. Look, what I would say to our parents and our grandparents that are listening to this program, if you know that's the case, not only do you have trauma, you may have an ongoing inflammatory reaction. But if a kid gets hit on top of the dietary patterns that some of these kids are consuming today, you've got a perfect storm that's going to cause all kinds of problems as time goes on. And all of a sudden you see that they're not learning the way they're supposed to. They're kind of distracted. They're told they have ADD, or they have a reversal pattern in how they process information. That's not okay. You got to get them checked. if you need to have a finger pointing, you can go to icakusa.com. Go to Kansas City. You'll find Dr. Mladenoff's information there. Reach out to them, and if you're in their area, anywhere near them, go see this man. He is the best of the best. If you're in our area, we'll examine this trauma, and we'll let you know what can be done, because we've dealt with it for many years. But don't neglect head trauma at any level. You catch it early. As Dr. Mladenoff said, the sooner is the better. You get it done, you can reverse it. You let it go too long, scar tissue degeneration, brain, I'll use the term meltdown. At some point, it becomes maybe untenable and no longer fixable. So pick up his book. It's going to be released. We'll have it. Doc, when can my kid play? Keep looking at it. We're going to have it on all of our websites, and look for it on Amazon, look for it on other social media sites. And I promise you, if you're going to know more than what you ever thought was possible in the field of concussion. Join me this Wednesday evening at the Roselle Center for Healing in Fairfax. We're going to be doing a night on head trauma, and we're going to show you some of the things that we do. And we're going to do some of the tests that Dr. M just talked about now. And we're going to show you what happens, and we're going to show you subtle vibrational problems that you didn't know that you had. I mean, your vibrational platform that is not working the way it's supposed to. Having said that, Dr. M, thank you so very, very much from the bottom of my heart. Thanks for taking the time, man. I owe you a trip. I'm going to come down and say hey.
Absolutely. If I could just say one thing, again, in the back of the book, make sure you follow those references and resources back there. We are putting together a seminar for patients that can't get to a doctor like you or can't get to me. So we're putting together this program. We will let people know when it's going to be, and it'll be a free online seminar where they can at least assess some of these simple things on their own, and then we can help them find a doctor that can take care of them.
Remember, my friends, we do this ongoingly and bring in amazing people like Dr. Evan Mladenoff for one reason only. We love you all. Have a great Sunday. Take care. See you next week.